Patient Maceo E. Donald, born April 15, 1988, has recently been transferred to me. Throughout this highly infectious global zombie outbreak, there have been reports of a small percentage of the population that are immune to the Z virus. Patient Maceo E. Donald is one of those inexplicably immune people. Maceo was bitten by a Z virus infected person 28 days ago and sustained minor surface bite wounds to the ankles that are no longer bleeding and are now open to air. Maceo also sustained a deep laceration on the radial side of the right forearm while jumping a fence and miraculously escaping the zombie attack. Maceo received 12 intermittent stitches on the arm and has been in care at another facility for nearly a month. They were recently transferred here. Those with immunity to the Z virus present as asymptomatic and do not share the need to feed on human flesh. Still, post-exposure, they inexplicably appear to lose the ability to heal acute wounds. Their wounds do not heal and remain an infection risk. Maceo's stitched arm wound is intact and well approximated, but has shown no signs of normal healing and has not progressed past the inflammatory to the proliferative phase, even after 28 days. There is presently no evidence that Maceo Donald is a transmission risk to healthcare workers. Still, the patient cannot be released until we know more about the Z virus. Maceo has been very cooperative, though anxious and confused about their condition. At this time, maintaining client comfort is a priority, as well as maintaining meticulous sterile technique in order to prevent wound infection.
Yeah?
Hello.
Hi.
My name is Rio. I'm a nurse here on the unit. Can I actually get your name and birthday?
Yeah, Maceo Donald. I was born April 15th, 1988.
Wonderful. And can I call you Maceo?
Yeah, that's fine.
Okay. And how are you doing today?
I'm doing alright, I'm here.
Okay, and when you say you're here, can you tell me a little bit more specifically how you're feeling?
The world has gone to shit. We got people out there devouring themselves and other people, so I guess I'm thankful to be alive.
Okay. Yeah, I feel like I've taken a look at your chart and your history. I've seen that you've been in care for 28 days now.
Yeah.
I know that normally we would have a television or radio, something to keep you preoccupied, but as you know, all of those systems are down.
Yeah, it is a little hard. I've been here a month now. No ways of communicating with my friends or family. Like you said, no TV, no radio. It's just kind of rough. I'm trying to keep occupied by reading books, but it's just hard to concentrate.
Mm-hmm. Do you feel like, are you enjoying any of the books that you're reading?
Yeah, a little bit. They're good distractions.
Okay, that's good. How's your pain doing?
My pain's okay. Like the wound itself is not really changed since the stitches were put in. It's not really that much better or worse.
Mm-hmm.
But my pain's okay. I took a pain pill about 45 minutes ago, and I think it's starting to kick in.
Right. So, in terms of the painkiller, I read on your chart that you took it about 45 minutes ago.
Mm-hmm.
Would you, if you had to rate your pain from 0 to 10, 0 being no pain at all, 10 being the worst pain of your life, how would you define your pain before you took the painkiller?
Well, the worst pain of my life was being bit by a zombie. So I would say before I took the pain, it was about a 6 or a 7.
Okay, and how about after, about now? How would you rate?
Closer to a 2.
Closer to a 2. Okay, that's pretty good. So since you're experiencing much less pain right now, I think it might be a really good time to do a dressing change on the stitch wound that you have right now.
Okay,
Does that
cool.
sound okay? So that would mostly involve taking out the old dressing, cleaning it up and assessing it, and then putting some new dressing on.
Sounds easy.
Does
Let's
that
do
sound
it.
okay? Okay. So the first thing I'm going to want to do is just loosen some of the dressing on your old wound, on your old dressing on your wound.
Okay.
So I'm just going to loosen some of that tape. As I take things off, everybody's different. Some people like to look at the wound while I'm undressing it. Other people like to just look away. What do you think?
I want to look at it, but you can explain it as you go along.
Absolutely. I can absolutely do that. I'll explain everything while we're doing it. And also let me know if you're experiencing any pain while I do everything. I'll try to be as careful as possible. Okay. You all right?
Yeah, this is good.
Look, everything's loose, so if you could just keep that there at a comfortable angle for me for a moment. The next thing I'm going to want to do is just prepare a little trash can for us. So that's there to put the old dressing and everything.
Okay.
And as we take everything off, of course, appreciate your cooperation in not making any sudden movements or anything. They're all very careful procedures that we're doing.
Gotcha.
Okay.
Just kidding.
Okay. And I'm going to be taking a look at the wound underneath and just assessing, because again, the most important thing right now is checking for infection.
Okay.
Okay. So I'm going to take off this first layer first. This is the outer protective layer,
Okay.
just to protect your wound from sort of the elements.
Mhm.
Everything's looking pretty dry. This middle layer is called an absorbent layer.
Mhm.
Sort of absorb any blood or possibly pus that are coming in.
Okay.
So take this one off. Again, looking pretty dry. And this inner layer is called the contact layer. That's in contact with your wound. So I'm going to pull that off very slowly. And once again, everything is looking quite dry.
Is that good?
I mean, it is good. I'm going to feel the wound to see if you're experiencing any tenderness in that. So you let me know if anything feels especially painful.
No, it feels fine.
It feels okay?
Yeah.
No area feels more inflamed or
No.
more sensitive than another?
No, it's great.
Okay. So the wound itself is looking what we call pretty well approximated. And what that really means is that the wound is staying close together.
Mm-hmm.
It's looking quite similar to a new wound.
Mm-hmm.
So I know that this wound is something that was stitched up 28 days ago.
Mhm.
You're correct to say that it's not healing in the ways that we would expect at this time, but at the same time it's not demonstrating anything that would tell us that there's an infection right now.
Okay.
So there's no excessive bleeding, no excessive swelling, a bit of redness, but not much.
Mm-hmm.
No pus.
Okay.
I'm going to feel for just heat, which would also tell us that there might be an infection here.
Mm-hmm.
Can I just compare that to your other arm?
Yeah, go for it.
Okay. So it's not feeling especially hot.
Okay.
And you've said there's no changes, itchiness,
No.
nothing. Okay. Okay, so I think the next thing that we'll do is clean the wound.
Okay.
Take these off.
Mm-hmm.
And again, you can just stay there in a comfortable position.
That's fine.
And the next step is actually to set up what we call a sterile field.
Mm-hmm.
And a sterile field is essentially a workspace that we consider sterile. So that involves setting up a workspace that nothing that is not sterile can touch the workspace. So we have to be very careful when not speaking and sneezing over the workspace too much, and being very careful.
Okay.
Okay. So I'm going to carefully undo all of this. Okay. So the kit does actually come with this drape just to put underneath your arm.
Okay.
I can touch the edges with my non-sterile fingers, but just the edges.
Okay.
So like that. Perfect.
Okay.
Okay. I'm going to put a little bit of sterile water inside to clean the wound with.
Okay.
Gently. And just date this for future use. Okay. A couple more items to put in.
Mm-hmm.
Okay, everything's looking ready. I'm just going to put on some sterile gloves.
Sounds good.
Your comfort is still okay over there?
Yeah, I'm doing fine, thank you. Tricky gloves.
They are tricky. Okay. So the next thing we're going to want to do is clean the wounds with this sterile water.
Okay.
So I'm going to moisten some of these. And again, let me know if you have any discomfort.
Okay. I'm doing alright so far.
Does that feel okay?
It's fine.
Just have one more on that last side. We did the middle, the left, and we'll just do the right side.
Okay.
It's okay?
Yeah, I was just a little cold.
Okay. Now I'm just going to want to dry it up a little bit
Okay.
because bacteria and infection do grow in moist environments. So we want to keep the wound as dry as possible.
I get that.
Does that feel all right?
Yeah, that feels fine.
Okay. The next thing we're going to want to do is put more dressing back on the wound.
Okay. Cool.
Just going to put it on the same way that we found it,
Okay.
including a contact layer. An absorbent layer,
Mm-hmm.
and lastly this protective layer on the outside. Okay. Do you think that will stay there?
Yeah, that's fine.
Okay. So I'm going to remove this so I can tape you back up.
Okay, sounds good. Do you know how long my wound is going to be like this?
It's very difficult to say right now.
Yeah.
We have, with your bite wounds, we've seen minimal progress.
Mm-hmm.
But at this time, the most important thing is just is to fend off infection.
Do you know if I'm going to turn into one of those things out there?
I understand why you would be upset and concerned. Especially right now, being in care and this time in the world, it can be really distressing.
Yeah.
I know that you recently saw a doctor,
Mm-hmm.
and the doctor spoke to you and let you know that though your wounds aren't healing the way that we'd like, you are not showing any signs of infection. And at this time, keeping you in care for monitoring
Mm-hmm.
and ensuring that nothing is getting infected is the most important thing. I also know that your sister is coming to see you soon, is she not?
Yeah, that's what I heard.
So anybody entering this facility needs to go for a 72-hour quarantine. So, and from my understanding, in one more day she can come in to see you. feel too tight or anything?
No, this is